Hello everyone, this is Dr. Cui. So in this topic, I'd like to discuss one of the questions that a student was asked during the interview. What was the biggest difference between first, second year and third, fourth year? So basically, I think because the interviewer didn't specifically ask the difference of the difference of you or the difference of the curriculum or courses you learned. So actually you have multiple ways to answer it. So here I will give some clues. You can definitely talk about the changes of curriculums. Like the first to the third year or second year, you are learning basic science. And the fourth to fifth years, you are learning of clinical knowledge and skills, and you are doing the clinical rotations during this time. So you so you can talk about that to see let them know that how can you apply those knowledge to the clinical rotation to the real clinics, and how to use those techniques to help the patient. And also you can talk about yourself. You become more mature. You know how to talk to the people, how to communicate with the patients more appropriately, and how and finally you add a reflection to each story, and let them know that how can you become a real doctor after the medical school study. So here I will give you my answer. Okay, Dr. Cui, can you tell me the difference between your first and second year, and the first to second year, and the third to the fifth year or 6 years? Yeah, of course. So I would say that during the first couple of years, I have learned all of those basic science knowledge, and actually, from that time, more I'm more clear that I definitely want to become a doctor. So then, after all of this study, as started from the fourth year, I had a chance to go to the real clinic and started my clinical rotation and see the patient. And during that time, I learned how to communicate with my patient, how to apply those knowledge I learned from the first to third year to the real clinic to explain those mechanisms behind the diseases and the treatment, and what's the mechanism of the medication we use for the patient. So in a word, I think I become more mature after after going to the med school, and after graduation. I really appreciate the experience I learned from my medical school, and finally I know I found a reason that why I want to become a doctor, and to help my patient. And after the after the last 2 years study in the clinic. So here, so you can see that in this answer, I told the interviewer that the difference of the curriculum of the first couple of years of my study and the last 3 to 4 years of my study. And also I told them I become more mature after the last 2 years clinical rotation. So, and also I add a reflection for this story that I'm more determined that I find a reason that why I want to become a real doctor after the graduation from the med school. So this is my answer. I hope it's also helpful for your answer as well. Good luck.